It's Colorectal Awareness Month. Are you getting tested regularly? If you've got achy muscles and joints, a new ultrasound machine at Sinai-Grace may pinpoint the problem. And a heart story you don't want to miss. These stories and more coming up next on Sinai-Grace Today. Hello, I'm Melanie Moss. If you're over 50, this story's for you. Colon cancer is the second leading cause of death in the United States. But if people were screened regularly, deaths would drop by 60%. The signs of colorectal cancer are stomach pains and cramps, blood in the stool, and unexplained weight loss. But you could be one of many people who don't have any symptoms. That's why a colonoscopy is so important.
Colonoscopy is a test that we do for diagnostic testing for screening for colorectal cancer. We do it for other studies as well if a patient is having abdominal pain or evidence of active bleeding. The procedure is about a 30-minute procedure. It entails sedation by anesthesia group. We insert a colonoscopy scope via the rectum and we advance it to the right side of the colon, looking for any mucosal abnormalities. We usually have 150 new cases per year. It's predominantly male, predominantly non-African American. Usually the rate or mortality from colorectal cancer is about 54%. So the colonoscopy is used to prevent cancer. Colon cancer is one of the most preventable cancer there is. You may not have any signs of symptoms, or the patient could be asymptomatic. So we do the colonoscopy in order to prevent colon cancer. Well, some studies have shown we can prevent colon cancer by different vitamins like vitamin C, calcium. Some studies have shown if we take an aspirin a day that prevents polyps, therefore preventing colon cancer. New studies are showing now, as with other things, obesity is a risk factor for colon cancer, so we always try to educate our patient in terms of keeping their BMI down and eating a good diet that consists of fiber and fruit.
The very first time when I seen the scope thing that they were going to use, I was like, whoa, and they were like, don't even look at that because you're going to be asleep, you won't feel anything, and they're right, you don't feel anything, you know. So it was good. The staff was great. I have to say they were awesome. Everybody talked to me. They explained everything that they were doing while they were doing it. And they told me good night when it was when they were putting me under. So everything went very well.
Your doctor may recommend colonoscopies every few years, but talk to them about having a yearly stool test. To reach your Sinai-Grace gastroenterologist, call 313-966-4800. You may not be going for the gold, but just hoping to minimize your joint aches and pains. A new ultrasound at Sinai-Grace may get you back in the game.
Then, we could always this new ultrasound machine is actually a wonderful thing to have because this is going to be in addition to other things that you take images of, which includes, of course, magnetic resonance imaging or MRI, and of course, CAT scans, computed tomography. Along with those two and what we call plain X-rays. The ultrasound machine now kind of rounds off everything we're in. We get to see with exquisite resolution all the soft tissues that people are usually concerned with, like tendons, ligaments, and muscles, along with the joints. And in the joints, we get to see the capsules and, of course, any abnormal fluid in the joint. It's highly portable, and when something is very portable, then it's quite accessible. The patients who would benefit most from this is anybody with joint aches and pains, and anybody in sports medicine or activities, athletic activities. And so when they have these injuries, then almost immediately, right, we could consider it bedside if you wish, but we call it point of care. That means right alongside the patient, sometimes in the dressing room, and many times in the playing field. I was fortunate enough to be invited in 3 areas. The first one is the United States Olympic Committee. And so, for example, at the Vancouver Olympics, I didn't have to be there. I was there to set up the machine. But what they did is they scanned one of our skiers, and they sent me her images via the internet. So this is a digital image, and so I was looking at her knee, and they were worried about her medial collateral ligament. And I told them it's either a healing ligament tear or a partial tear. They allowed her to ski, and she went on to win the gold medal. The second area where I was fortunate enough to join is NASA, the National Aeronautics Space Agency. Aside from reading the ultrasounds for the astronauts in the space station, we also train the mission control surgeons, and we had one of our first graduates here. Our chairman, Dr. Raul Vadia, and our director, Dr. Stephen Lemus, you know, they help us train the mission control specialist, and now he's fully certified in musculoskeletal ultrasound. The last one is Dr. James Andrews. He is a very famous orthopedic surgeon, and he's done many famous athletes, most recently one of the Redskin players in Washington, D.C. And he uses it frequently. And so we've been helping to diagnose these things to become more accurate in our therapy for the patients, and most of all, for our athletes to return to play, but also one more time for our patients, you know, return to work, and to make sure that they're very comfortable with whatever things we treated them for, and so therefore they can walk around and feel as normal as possible.
To reach a Sinai-Grace Hospital orthopedic specialist, call 313-966-4800. Heart Awareness Month may be over, but it doesn't mean it's time to forget about being heart smart. We caught up with one patient at the Sinai-Grace Cardiac Rehabilitation Center who would be the last person you expect to have a heart attack.
On November 25th, I had chest pain down the sternum, neck, arm, up the throat, down my back, and I went to another health system, and I was misdiagnosed as having a vertebrae problem. They were going to do an EKG, then they decided not to, and simply did an x-ray, said I had arthritis, sent me home with Valium for muscle spasms. So it went away. The next day I was coming back from Ann Arbor, and it hit again. So I went to friends and asked them to call the rescue squad, and as soon as they opened the door, they started yelling heart attack. And they were able to identify me very quickly. They didn't even put me in the paperwork system, and 2 DMC doctors. One of them happened to be there, who was a cardiologist, and he immediately started working on me to save my life. I had a 100% occlusion, and they put a stent in, which was very successful. And then it was recommended that I be in cardiac rehab because I have muscle damage to the heart. But they expect that with cardiac rehab, I should be able to rebuild some new vessels or arteries or something to help the heart get stronger and have a productive life. After you have a heart attack, there are different levels of programs here. The first one after a heart attack is you have to be on a heart monitor. So when you come in here, you're on a heart monitor the whole time. They take your blood pressure if you're diabetic. They take your blood sugar as soon as you walk in the door. Then they put the monitor on you, and then you're on 3 different bicycles and 1 treadmill, and each one is 8 minutes each. During each one of those rotations, they're taking your blood pressure. Another person's watching you every second to see what your heart rate is. However long it takes you to finish this round of monitored exercise, then you're allowed to go on to a class where you're not on a monitor. So they're educating you constantly, and the staff here is very friendly and amenable to answering questions. It's really a very nice program. This is really vital. If I want to be alive in 3 years, I need to be doing this.
To contact a Sinai-Grace Hospital cardiologist, call 313-966-4800. One of the easiest ways to stay heart healthy is through a proper diet. Lesley Harding talks with a Sinai-Grace Nutritionist about what's what on the back of the box.
While most of us try to be good and eat healthy, eat nutritious, sometimes it can be awfully hard to decipher what's fact and fiction on the back of a food label. I'm here with Mandy. She's a dietitian at Sinai-Grace Hospital, and she's here to help us read these labels. Mandy, what are some of the first things that we should be looking for?
So when we pick up a food item, we need to look at the serving size for that container, because a lot of times you are thinking that you're getting
Right.
what it says on the back, but actually that food item has 2, 3, 10 servings in that container.
Something we should be splitting.
Exactly. So serving size is very important. And also I wanted to point out the percent daily value on the side is based on a 2,000 calorie diet, which some of us require more and some less. So, but it is a good guide.
Okay. Now, I know some people who count calories. There's other people who look at fat, and then some swear by just add up the carbs and you're good. What should we really be counting?
Well, there's no right answer to that, but I do have to say that counting calories will not add up to healthy eating. And so to follow a heart-healthy eating habits, when we pick up a label, you'll want to look at total fat for that serving and fiber, how much fiber is in there. And so for total fat, roughly we need 25 to 30% of our calories coming from fat. And of course we want to pick good fats, but more on that at another time. And fiber, we want to aim for at least 25 grams of fiber per day.
Now, you talked about a heart-healthy diet. I know that salt is a big no-no when it comes to heart health. Should we be looking at that?
Oh yes, for sure. So it's recommended that we take in less than 2,300 milligrams of sodium per day. So, and then for those who have hypertension, diabetes, and chronic kidney disease, it is recommended to take in less than 1,500 milligrams of sodium. So saying that, for example, this can of white chicken chili, if there's 2 servings in this container, so if we were to eat this whole entire container, we're going to get 1,620 milligrams of sodium. So we're pretty much done for the day.
Wow, wow. What about some other things like vitamins and minerals?
So vitamins and minerals, and on these food labels, the percent daily value for vitamins and minerals is a very good guide to show us if something is high in certain vitamins and minerals. Like for example, what's a good source of iron? You know, so looking at this Fiber One cereal, if we were, the serving size is 1 pouch. So looking at the percent daily value for iron, we're going to get 25% of our daily value coming from iron, which is a very good source of iron. Yeah.
Before we wrap up, is there anything else that we should keep our eye on?
Yes, trans fat. Trans fat is not, there's no daily value set by the FDA. And the American Heart Association recommends that we get less than 1% of our daily value from trans fat. And what trans fat is, it's a synthetic fat that is a byproduct of hydrogenating, partially hydrogenating an oil to extend the shelf life of a food product and make it taste a little better. And so the reason these fats are so terrible for us is that our body has a hard time digesting them, and when it gets into our arteries it turns to sludge. So you really don't want any of it. And looking on a label, I'm going to tell you how to look for that, because it's not always listed. They don't have to list it if it's less than 0.5 grams per serving. So for example, if a food item is, the serving size is a teaspoon, and you know you're going to be using 5-10 teaspoons of that item, well, there's trans fat in it, but they didn't list it. So if you're using that much of it, you're going to get quite a large amount of trans fat. So a way to figure out if that item has trans fat in it, since it's not listed on the label, you want to look at the ingredients, and if you see anywhere in that ingredients partially hydrogenated oil, the product has trans fat. And you'll see trans fat most commonly in commercial baked goods, cookies, cakes, crackers, and shortening. So beware and try to cut it out of your diet.
Sounds like we should be walking around with a calculator. I do know that there are some good fitness apps for your phone and some calorie counter apps for your smartphone, so you might want to look into those. And in the very least, I would assume taking a journal around with you, and what you're writing, what you're eating, write it down every day.
I agree.
Thank you so much for being with us, Mandy. We'll have you back.
Thank you.
For these stories and more, you can visit our Facebook and YouTube pages for every episode of Sinai-Grace Today. Also, log on to pagingdredie.wordpress.com for great health information. I'm Melanie Moss. Thanks for watching.